Recognizing the signs of an opioid overdose and knowing how to give naloxone can save a life. Opioids are powerful drugs that are used to treat pain, but can also create a dopamine response in the brain or a high that can contribute to substance use disorder. They can be prescribed by a physician or synthetically produced and sold illegally on the street. There are many different prescription opioids that are used by people in our community, and these medications can be used in the treatment of opioid addiction. Canadians are the second highest per capita consumers of opioids in the world, and Ontario has the highest rates of opioid deaths in the country. Potential harm from street drugs are made worse when supply is contaminated with synthetic opioids like fentanyl and carfentanil, as well as stimulants and benzodiazepines. Fentanyl is about 100 times stronger than morphine. Carfentanil is 10,000 times stronger than morphine or heroin. You can't see, smell, or taste it, and a person using the drug would never know the dose they're taking. With potent opioids in our community, it's important to remember that we all have a role to play in reducing harms. Only take medication as prescribed. Never share medication. Lock and store in a safe place. Safely discard unused or expired medication, and talk about substance use. If you or someone you know uses substances, there are ways to reduce the risk of an opioid overdose. Avoid mixing drugs. Avoid drinking alcohol when using drugs. Start with a lower dose and go slow. Avoid using a drug alone. Carry a naloxone kit. And call 911 if you suspect an overdose. If you or someone you know is alone, the Overdose Prevention Line is available to make sure someone checks up on you. You can access it by calling 1-888-688-6677. Someone may have overdosed if they're dizzy or confused, cannot be woken up, or has difficulty staying awake. Their breathing is slow or stopped, or you can hear choking or gurgling sounds. They have blue lips, nails, pupils are tiny, or eyes are rolled back and their body is limp. Don't let fear stop you from calling emergency services. The Good Samaritan Act provides some legal protection for individuals calling 911 during an overdose. The Act can protect you from charges of possession of a controlled substance or breach of conditions regarding simple possession of controlled substances in certain situations. After calling 911, give naloxone. Naloxone is the medication that can temporarily reverse the effects of an opioid overdose. The key words here are temporarily and reverse. Naloxone can restore breathing within 2 to 5 minutes. When a person takes an opioid, it affects certain receptors in their brain. Naloxone works by kicking opioids off the receptors and attaching to the receptors instead. This temporarily reverses or blocks the effects of opioids for a period of time. Naloxone only works if there are opioids in the person's system, like fentanyl, heroin, morphine, or codeine. It does not reverse the effects of non-opioids such as cocaine, benzodiazepines, or alcohol. Naloxone is only effective in the body for 20 to 90 minutes, and the effects of most opioids last longer. This means the effects of naloxone will likely wear off before the opioids, which can cause breathing to stop again. Naloxone may need to be used again, depending on the amount or type of opioid taken or how the opioids were taken, for example by mouth or injection. Naloxone is safe for all ages and only works if you have opioids in your system. You cannot use naloxone improperly, and you cannot hurt someone if you give it to them and they've not used opioids. In a naloxone kit, you will find the hard shell case, 2 2 4 mg naloxone hydrochloride in 0.1 mg solution nasal sprays, 1 pair of non-latex gloves, product information, a client identifier card, a National Overdose Response Service card, and the 5 steps to respond to an opioid overdose insert. Here are the 5 steps to respond to an opioid overdose. Step 1. Shake and shout. While wearing a face mask and gloves, shake their shoulders and shout their name. Step 2. Call 911. Always call 911 when someone is unresponsive. Put the person in the recovery position if you need to leave them. Step 3. Give naloxone. Lay the person on their back. Place the nozzle deep into the nostril and press the plunger firmly for a full dose. Step 4. Give chest compressions. Place your hands on top of one another in the middle of the person's chest, keeping your arms straight. Push fast, push hard, with no interruptions, except to administer naloxone. Step 5. Is it working? If the person has not woken up or breathing is not better in 2 to 3 minutes, give a second dose of naloxone to the other nostril. Continue to give chest compressions until the person is breathing on their own or until paramedics arrive. Repeat doses may be needed. If the person resumes breathing, talk with them and let them know that you're putting them in the recovery position. Giving naloxone to someone who has an opioid use disorder may cause symptoms of withdrawal, including restlessness, nausea, convulsions, vomiting, sweating, and a fast heart rate. This is not a pleasant experience, and the person may become agitated. It's important to support the person by following their lead as they recover from the overdose after being given naloxone. Kindness and compassion go a long way. Tell them your name, remind them where you are, and ask them what they need. Be sure to stay with the person until emergency responders arrive. Watch for signs of overdose symptoms returning, and be ready to give another dose of naloxone if needed. It's important to note that you should not use naloxone if you or the person giving it to has or shows signs of hypersensitivity. Naloxone should be used during pregnancy if clearly needed. Breastfeeding should be stopped for 12 to 24 hours due to the amount of opioid in the milk and potential risk to the baby. If opioids are used regularly, breastfeeding should be stopped, and the person should be referred to a healthcare provider. The Health Unit's Healthy Families Feeding and Nutrition Clinic offers one-to-one support to help people make informed feeding or nutrition decisions that are best for their family. A registered nurse or registered dietitian can provide free, in-person, virtual, or phone support. Naloxone should not be kept at extreme temperatures. If it freezes or is kept over 40 degrees Celsius, like in a hot car, it should be replaced. Regularly check the expiry date. You can get a refill and return any expiring naloxone to a local pharmacy. Naloxone is available at a variety of locations, including some local pharmacies. By taking time to understand opioids, recognizing the signs of an overdose, and knowing what to do, you can save a life. If you have any questions, please contact our harm reduction team.